let's speak to Niall Dickson, Chief Executive of the NHS Confederation, representing organisations right across the healthcare sector. What did you think, Neil, when you heard the Prime Minister's comments?
Well, people are interpreting his comments in different ways. So if I set aside, I don't know what he meant. What I think is true is that we'd have to acknowledge that there have been mistakes made centrally, locally, in all sorts of ways as people have tried to cope with the pandemic. Not sure this is the right time to start apportioning blame, and that when we have an inquiry, we will need to look at what we did. I think what is acknowledged on all sides is that we didn't at the beginning really understand, and when I say we, I mean at all levels, probably understand the level of vulnerability. We did know that care homes were vulnerable.
The evidence was there from Italy, wasn't it?
Yeah,
very
the
clearly that older people
from Italy that the NHS might completely fall over, and that the NHS would not have enough ventilators, that would not. So
although the Italy experience was very, very concentrated in one particular area, which is why their health system really struggled, and it spread quite differently in the rest of the United Kingdom, didn't it?
Of course, and different countries different ways, but I can remember coming on the BBC at the very beginning of this, and the whole focus of the media and everybody else was the NHS will not be able to cope. You have not got enough intensive care beds. Yeah. You have not got the staff. You will not be able to do it. Now, the NHS did respond. We said then, I think we probably were more optimistic sounding than we were, but that the NHS would cope, that it would manage to meet and it was able to flex, and it was able to flex up to a point, and there was obviously going to be a point where any healthcare system would fail. There were, right at the beginning, there was an awareness, I think, at the centre, and I'm not speaking for the government, but there was an awareness at the centre of the vulnerability of homes, and some very basic stuff was put in about don't have relatives visiting and all the rest of it. But I don't think the real vulnerability of homes, both in terms of staff and residents, was fully taken into account in those early days. And we need to learn that. And we also need to learn, how do we, going forward, instead of blaming bits of the system, how do we get health and care working much more closely together so that they support each other? And and it is both ways, as it were. But certainly small homes, may not have the infection control training. They may not have and they didn't have the PPE at the early stages. That was another failing, as it were, in the process.
Well, PPE was being heavily directed towards the NHS, and hospitals were being prioritised, weren't they? But the Prime Minister talks about...
Well, it's only partly that. It was partly also, frankly, that they didn't, and this is obviously a vulnerability, they didn't actually have a system for distributing to small bits of the system. Right. So some of our members, community organisations and trusts, GP practices, those people also were difficult, because the whole system of distributing PPE at the beginning was putting things in the back of lorries with huge amounts of stuff, which was not tailored, and we didn't actually have a system whereby it could target and accurately go to places that would say we need this amount and that amount and so forth. So
a couple of things
in place at the beginning.
A couple of things that perhaps you could clearly point the finger at central government for. One, there wasn't an action plan for the care sector published until the middle of April, till the 15th of April in England. I mean, that's, when we're in the thick of it, when we're right in the middle of lockdown. And the other thing, of course, which everyone keeps coming back to, is people being transferred from hospital into care homes without being tested, knowing the vulnerabilities there.
OK, so the first point around when actions were taken at particular points, I think that absolutely is something that we need to look at and obviously learn from. I have a degree of sympathy, which may not be shared by everybody, about people at the centre trying to cope with a whole series of different things at different times. But I think there's clearly a case that the mindset was not focused enough on the vulnerability of the social care sector, and its fragility is partly a result of underfunding from successive governments and the inability to try and reform how the sector is organised and so forth, and its links with the healthcare system. So I think that's absolutely something that people should go for. As far as the discharge from hospitals are concerned, I think, again, there's no doubt, and I think everybody would accept, that there were some patients who were transferred. I don't think that is denied, that should have been tested and so forth beforehand. On the other hand, I mean, if you look at the overall figures, my understanding is actually the number of patients transferred into care homes over the critical period actually fell during that time. It didn't rise compared with normal. So I think we need to look in detail, and again, I don't have the information at the moment, and I don't think anybody else does, about exactly what happened during that time. What I do think is wrong is to suggest that people in hospitals were, in a cavalier fashion, just sending out doctors and nurses and so on, making decisions to let's get rid of these people and throw them into care homes.
Sure, yeah.
I don't think that was happening on the ground, and I think we do need to understand exactly what was happening. And I think we also need to recognise that some of the problems, obviously, are that care homes are underfunded, and actually I think the health service both has to work much more closely and perhaps more supportively going forward, so that care homes themselves are able to manage patients without necessarily referring them into the hospital sector as much as happens at the moment.
Thank you very much.